Thank you for being with us. My name is Casey Minnis. I'm the Director of Communications for the Multiple Sclerosis Foundation. And tonight I'm joined by Tyler Brown. Tyler Brown, Psy.D, joined Shepherd Center in August 2020 as a rehabilitation psychologist. He earned his bachelor's in psychology at Lander University in Greenwood, South Carolina. He earned his master's in psychology at Augusta State University before continuing his graduate education and earning a master's in clinical medical psychology and his doctorate in psychology at Mercer University in Atlanta, Georgia. He completed his clinical internship at Wichita State Counseling Center and Kansas University School of Medicine as part of the Wichita Collaborative Psychology Internship Program in Wichita. He completed his postdoctoral fellowship at MedStar National Rehabilitation Hospital in Washington, D.C. Dr. Brown is also an adjunct professor at Mercer University. He has a passion for providing evidence-based treatment to individuals and their families dealing with a variety of complex medical conditions, including spinal cord injury, MS, chronic pain, and amputation. We're pleased to have him here tonight to talk about how to get your family to really listen to what you're saying about your MS. Dr. Brown, thank you for being here, and I'll turn it over to you.
All right, thank you. Just to start off, I want to say I love doing these, so I'm really glad to be back. I know the talk is, how to get your family to really listen to you about your MS, but I'm really hoping anyone listening in today can benefit from this conversation, whether you're someone who's diagnosed with MS or whether it's your care partner, your spouse, your family, whomever might be tuning in with you today. I hope that everyone can walk away with something from this talk. Disclosures, something we always talk about. I have no disclosures. That's always my favorite slide. It's like the quickest one to get through. So today I want to talk a little bit about some of the learning objectives we'll have first, just to kind of set the template for what we're going to do today. First, I want to discuss aspects of communication, basic communication, and then kind of how we define that in terms of what that looks like within a healthy relationship. Then I want to discuss some of the disruptions that commonly occur in healthy relationships, specifically with people dealing with MS or chronic health conditions. Then discussing some of the common communication styles. So we'll get a little bit into that. I'll say this again later, but kind of one thing to express is there's a lot of different ways to talk about communication. I've kind of chosen one style, but I could give hours and hours and hours of presentation talking about communication. So I've gotten one style here that I think fits well for the time that we're allotted today. And then we're going to jump from that model of communication style and discuss some individual strategies to enhance communication. So talking about what these communication styles are, and when you say, okay, that kind of fits me, I have that communication style. Well, here's some of the things that you can work on individually to maybe enhance your communication style and become a better communicator. And then we're also going to discuss relationship strategies to enhance communication. So how do you talk to someone or relate to someone that has a certain communication style? So jumping into aspects of healthy relationships, what makes a healthy relationship? This is by no means a textbook definition. This is kind of some of my own personal thoughts and musings, and it's not an exhaustive list either. I'm sure you can think of a lot of different things to add to this list. I think healthy relationships, one, are built on communication. That's what we're here to talk about today. One thing I want to say up front, and you'll hear me say this a lot today, we often think of communication just about the words we say, but it's a lot more than that, right? There's a lot of different ways we communicate. It's not only the words we say, but we have different modes of communication, especially in the age of technology. We can communicate via written word, text messages, books, newspapers, emails. We can talk verbally with language like I'm doing right now. And then there's like nonverbal communication too. And I often feel like a lot of times that's the one that gets ignored a little bit. We don't talk about that one quite as much. And I think when we're communicating with other people, sometimes we neglect the importance of that. So we'll talk a little bit about the nonverbal communication that occurs between people as well. I think trust is another important aspect of a healthy relationship and of good communication. If I don't trust you, then I'm not going to be vulnerable with you. I'm not going to share things with you. I'm not going to be motivated to tell you how I'm feeling or how I'm doing, or to trust you with maybe whatever I'm going through. Respect on a similar lines is an important part of healthy relationships and good communication. If I don't respect you, then I'm not really going to want to listen to you, right? I'm not going to hear what you're saying. And if you don't respect me, then I'm not going to want to talk to you. I'm not going to want to communicate with you. So respect is reciprocal. We both have to be respected and give respect in order to maintain sort of a healthy communication style. Connection. So I think good communication is usually based around having some sort of connection, right? Some sort of common goal. Like, what are we trying to do here? What are we trying to accomplish? What's connecting us or binding us? What are we working toward together? So that connectivity is a very important part of healthy communication. If we don't see eye to eye, if we're not working toward the same goals, if we're not working down the same path, then communication is going to be quite difficult, because we're going to want to go in opposite directions. And then finally, honesty and openness, right? So it kind of goes along with trust and respect, but we have to have a certain amount of vulnerability. We not only have to trust the people that we're communicating to, but we have to be honest and open ourselves. We have to be willing to be vulnerable and to share what's going on with us, and to be honest about what's going on with us, and not have to sort of censor ourselves in a way that doesn't really convey how we're really feeling. And that can be another barrier to healthy communication. So briefly talking about some of the disruptions to communication. Again, this is something I feel like I could talk about all night if I had the opportunity to, but just a couple that I feel like I see most often when communication is an issue that's brought to my attention when I'm working with people. In the MS population, MS symptoms can be a major barrier to communication. They can both be a direct impact on communication. So things like cognitive issues, such as memory, attention, processing speed, those can work to disrupt communication in various ways. And also change in the roles or the needs for others, right? So with the advent of MS symptoms, that might change, and that's kind of getting at something that I have down there at the bottom, power differentials. Roles change, and when roles change, that can become really awkward. So all of a sudden, an example of that might be you have a child who's becoming a care partner to a parent, right? And all of a sudden that dynamic changes, and maybe the child's having to take more of a leadership role, and that can be really uncomfortable for the parent. Or a parent becoming the care partner for an adult child, right? Someone who's gone out of the house and built their individual identity and built their autonomy, and all of a sudden maybe they're in a greater need of dependence or care than they were before, and that can really be a major barrier for communication. So changes in those roles and the way those roles play out as a result of actual symptoms can also be a major barrier. And then they can also indirectly impact communication, right? So I know a lot of things that I hear often from people I work with, especially with MS, are the so-called the invisible symptoms, the things that other people can't see that make it difficult for care partners to understand. I also do a lot of work with pain management, and that's another arena where I often see a lot of frustration on the patient side, because it's like, well, I just wish they could understand, like they can't really see it. It's not like a broken arm that's kind of like dangling off of me, and they just don't seem to be able to wrap their head around about like what that feels like, what that MS fog or that fatigue or that pain really feels like, because there's just not this visible thing that they can use as sort of a hallmark for what I'm going through. I don't know, I already kind of mentioned this a little bit already, but power differentials, right? So those shifting roles and responsibilities can often be a barrier to communication, that leaves someone feeling like they've lost power in the relationship, or they've lost some of the strength of the identity they had, and that can make communication very difficult. And then Another major barrier to communication are things like financial hardships, types of things that people might start to fight over or really argue about, things that can help or things that will build resentment or anger. Finances being one that I hear about quite often. Those can also be major barriers to communication. So now we're going to talk a little bit about styles of communication. Communication styles can really change the way that we interact with each other, both the way that we're communicating and the way that the person that we're talking to is communicating back to us, right? So even though we'll be talking about specific styles today, I think one thing to keep in mind is their styles might change depending on how we act and how the person we're talking to acts. So we kind of are constantly giving each other feedback when we're communicating, right? And that changes the way that we interact with others. So to that extent, it's really important that we not only understand ourselves and our styles, but that we also understand the styles of the other person to be able to enhance that communication, to be able to say, okay, this is how other people see me, and this is how I come across. And this is how this other person comes across to me. And then that's going to change the way I interact with that person, right? It's going to change the way maybe I talk to that person. And like I said earlier, there's a lot of different ways to interpret or analyze styles of communication, different theories of communication. So we're choosing one to focus on today, but by no means is that an exhaustive conversation. Today, we're going to discuss communication styles along the following paradigm. So we're going to talk about passive communication styles, aggressive communication styles, passive aggressive communication styles, and then assertiveness, with the gold standard sort of being developing a more assertive style and moving away from the other three. So we'll talk about passive styles first. So what defines a passive style of communication? Well, behaviorally, what you see from someone who has a passive style, they generally lack expressiveness. They're not going to be very animated. They're going to be guarded in a way that's not defensive, but almost submissive, right? So they're going to kind of have a slouch posture, kind of shoulders forward, looking down. They're going to have poor eye contact, poor posture. It's sort of a sign of submissiveness. Hey, don't attack me. Don't hurt me. They tend to speak very softly or apologetically. So someone who like apologizes for every little thing, like even if you're not necessarily being critical or looking for an apology, it might be someone who's very quick to apologize. Like I said, speak softly. Some of the consequences of this, the way this kind of emerges for the person who has the passive style, they tend to be very anxious. That anxiety comes from their perceived lack of control, right? Like, I don't really know what to do in this environment. I don't know what to say. I'm scared if I say something, the other person might attack me or hurt me in some way. I don't really know what to do. I don't have any control in this situation, and that's frightening. Depression, which kind of manifests through helplessness and hopelessness. Hopelessness being the belief that nothing's going to get better, right? Nothing's going to get better. There's nothing anything can do to improve the situation. And then helplessness, where hopelessness is more about the environment or the situation. Helplessness is about a person's personal feelings about themselves. Helplessness means there's nothing I can do about this. I can't do anything to make the situation better. There's nothing I can say that's going to work, right? I just kind of be quiet and do nothing and not risk being attacked, or if I do speak, then I'm scared I'm going to get attacked, and I don't want that either. This can lead to a sense of resentfulness. Well, no one listens to me, no one pays attention to me, no one cares about me. And that emerges because with the passive style, your needs are never going to get met. People don't understand maybe what your needs are. You don't advocate for your needs, so they really aren't going to get met. And then also feeling stuck, feeling like you're not getting anywhere in your life, feeling like you're not improving. And again, that comes from those needs not being met. So I've already kind of covered the dialogue here a little bit, but things that you might typically hear someone with a passive style say, or some of their internal dialogue, what they might tell themselves. People never consider my feelings. Other people always walk over me. no one listens to me, those types of things. So my representation for passiveness today, if you've ever seen the movie Office Space, is Milton. I think he's sort of a perfect example of someone who's very passive. He goes from being in a cubicle to, by the end of the movie, he's in sort of a closet in the basement, right? Because people just keep kind of walking all over him, and he doesn't really stand up for himself. When he tries to stand up for himself, he's so soft-spoken that people just talk over him. So if you feel like you have a passive style of communication, here's just a couple of tips I would give you on how, the kind of things to work on. So one, I think, is learning to be confident in yourself and your needs, right? Everyone's needs in a conversation are important. The other person's needs aren't more important than yours, and yours aren't more important than theirs. Like, everyone's needs are equally important, and everyone's needs are valid. So whatever you feel like it is you need, you should be able to express that, right? You should be able to feel like that's valid, and it doesn't really matter what the other person says or feels about that. That doesn't invalidate what your needs are. Your needs are your needs. I think it's always important for people with passive styles to learn the value in saying no. So really, to expand upon that, really boundary setting, right? So the ability to say, like, I'm not comfortable with that. I don't think that I can do that right now, right? You don't have to feel guilty about setting boundaries. I think that's sort of a big barrier for people with passive communication. Either they fear retaliation of what will happen if they say no, or they don't want to feel guilty about having set that boundary. And I can tell you, even as a young professional, this is something like, it was hard for me to learn to say no. But when I figured out how to say no and how to set those boundaries, things really improved for me, right? Not overextending myself. One thing I'll say about people with passive communications is that you're very good at compromise, right? So like, you're someone who's going to really listen to the other person. Chances are you might already be a good listener, and you're willing to offer the olive branch. But what you need to learn is not to compromise on everything. And what I'll often tell people is compromise happens when you feel like you've gotten something and given something, right? So there's the reciprocity again. If you give up everything, that's not compromise, that's sacrifice. And if you've gotten something and haven't given anything, that's not compromise, that's victory, right? And we're going to talk about that in a minute when we talk more about like aggressive communication styles. So if you're interacting with someone who's passive, right? So maybe you don't feel like you're passive, but you're talking to someone who has a passive style. Here's a couple of tips on sort of how to interact with them. The biggest thing I think you can do is directly ask their opinions. Hey, what are your thoughts on this? I've been talking for a little while. How are you feeling about what I'm saying? How are you receiving my message? What do you think we should do about this situation? So you're giving them a safe environment to be able to express themselves, right? You're giving them that space to talk. And then also allowing for breaks or opportunities in the conversation for them to be heard. So just kind of reminding yourself, okay, this is someone with passive communication. I'm going to kind of give them the floor to speak, and I'm just going to sit back and listen. And that's my role in that moment, is just to sit back and listen. Give them time to express themselves, right? If someone is trying to have a more assertive style, if they're passive, it might be difficult for them to really express their needs. It might be difficult for them to find the right words. So whether they need a few minutes, a few hours, or a few days, you have to give them time to be able to sort of formulate their opinion, think about the matter, and then express themselves the way that they feel comfortable. Don'ts in the situation, don't dismiss their ideas, right? Don't be like, no, that doesn't make a whole lot of sense to me. I'm going to tell you why. Instead, highlight the positives of their suggestions and validate their views and feelings. Like, hey, I'm glad you shared that with me. I know it's difficult for you to talk about some of these things, so I really appreciate that. I value kind of what you said there, and I'd like to talk about that a little bit more. Could you expand on what you meant by this, right? So you're giving them positive reinforcement for doing something that's very difficult for them to do. And the most important thing is to avoid attacking them avoid interrupting them. Don't respond with angry body language, right? If you're furrowing your brow and kind of clenching your teeth, they're not going to want to open up. And don't be confrontational, right? It's not a fight, it's communication. Like, we're supposed to be communicating with each other. And if you think about it, a lot of times people that develop passive styles we develop our communication styles based on our past relationships, right? So someone who's passive might be used to being attacked, used to being interrupted, used to being criticized. And so they're going to shut down when they're met with that in a conversation. So you kind of have to give them that floor and that opportunity. All right, now talking about the second style, aggressiveness, kind of the total opposite of passiveness. So behaviorally, these are people that are often going to dominate others in conversations. It's not about compromise, it's about winning. I need that victory. I need to feel like I've emerged on top. They'll often criticize, blame, and attack others. They tend to use you statements more than I statements. This is your fault, you caused this, you did this. It's blame, right? They often might have a low frustration tolerance, so they have a short fuse. Poor listeners, so they're ones that are going to want to interrupt and they're going to want to talk. They don't want to wait their turn, and they're certainly not going to listen very well. The consequences to this, because it's interesting, because I think in their mind they're like, okay, I got to win, I got to come out with my fists up, kind of mentality. But ultimately, the consequences for them are still negative. They often get alienated from their relationships. People don't want to interact with people that act like this. They generate fear and avoidance in others. Again, avoidance. I don't want to be anywhere near you. And when I am near you, I'm uncomfortable. I don't want to interact with you. And then they typically have that blame. Since they have that blame for others, their needs are not getting met either. So just like the passive person, their needs are never met. Like, I'm not going to want to interact with you. I'm not going to want to listen to you if you're being aggressive. So you're not going to get what you want from me. I might say something in the moment to just get you to go away, or to get you to not be mad or angry at me, but ultimately I'm not going to have any vested interest in giving you what you want. Some of the dialogue that you might typically see is sort of, I'll get my way, I'm entitled to this, I deserve this, it's all your fault. So there's the you statements again. And it's kind of this you owe me mentality, like, I deserve this, you owe me. One of my favorite shows, Breaking Bad, if you look at Walter White in the early seasons, he has a very passive personality. And then as the show evolves, especially toward the end of the show, he has a very strong sense of entitlement. He has a much more aggressive demeanor. So I think he's a good representative here, especially like in the later seasons of a very aggressive personality. I'm going to get what I want no matter what kind of attitude. So if you feel like you're someone who's maybe a little bit too aggressive in a conversation, here's some tips that I would sort of give you. One, a positive, you have confidence, right, in your stance. Like, you're already someone who's confident. So like how I said, the passive person is a good listener. You're someone who already has confidence. That's the positive attribute to someone who might have an aggressive style. So for you, it's really about acknowledging the thoughts and feelings of others, taking a step back, giving people a chance to talk, and then listening and learning to listen. So how is my delivery affecting the person receiving it, right? What is what I'm saying, and how is that affecting the other person? What's their body language? So when I interact with this person and I'm kind of aggressive, what do they do? Try to notice that effect you have on people. And do I need to give them time to speak? When do I need to learn to be quiet and let the other person talk? I think you can examine your own body language. So both proximity, people who are aggressive tend to be really like close in an uncomfortable way. Your tone of voice, is it very, is it angry? Is it aggressive? And then your gestures and your mannerisms. Are you someone who's sitting there like tight, tense with your arms crossed and your jaw clenched? Loosen up. Like, relax your body posture a little bit. And then I think ultimately changing your point of view, right? The goal of communication in a healthy relationship is not to win. It's to meet everyone's needs through compromise, right? This isn't a football game. This isn't the Super Bowl. You're not going to walk away with a ring out of this. If it's a healthy relationship, if it's someone you care about, then your goal should always be compromise, not winning. And I think just reflecting on that can be really important. In terms of how to interact with someone who has an aggressive communication style, that can be a little bit more tricky because they typically might be someone who's dominating the conversation and can be really difficult to talk to about their style. So I encourage people to sort of prepare for their tone and demeanor. You kind of already know maybe what to expect, so you can kind of prepare for that. Sometimes the level head prevails and sets a new tone. What I mean by that is a lot of times when people get aggressive, we want to respond with aggressiveness, and that's not necessarily the best thing either. There have been times when I've had to deal with very difficult people, and I've learned that when I can be kind of calm, and when I talk to them calmly and I just kind of like nod and just kind of keep my body posture relaxed, they sometimes will just kind of cool off, right? They'll kind of like run out of steam. And it's almost like you reach a point where you kind of see the light bulb turn on for them. And it's like, wow, they're not fighting me back. Like I look kind of ridiculous right now. And I think there's this sort of natural tendency for them to calm down a little bit. Respectfully suggest breaks to say like, hey, this thing's getting really heated right now. You know, I think we're really getting at each other right here. Let's just take a quick time out and revisit this thing in 10 minutes. You can always offer an olive branch, but without giving in to demands, right? So it's not about giving demands. It's just kind of like, okay, I hear what you're saying. You're very angry about this situation. I want to reach a compromise. Let's find a middle ground here, right? So like, let's just take a moment and just kind of reset. Let's reset and start over. Using I statements, I'm going to talk about that a little bit when we get to assertiveness. So just give me a minute and we'll come back to that one. And then I often tell people to be strategic when to address sensitive topics, right? If you're dealing with somebody who's very aggressive and they're already maybe a little bit annoyed that day, maybe that's not the most appropriate time to bring up that thing that you've kind of been wanting to talk to them about, because you're more likely to get that short temper. Passive aggressive. I think a lot of people would argue this is one of the most difficult personalities to interact with because it's a mix of both, right? It's someone who behaviorally presents as passive, but internally kind of has this rage or this anger about them. So you're getting a competing signal. So they'll use very opposing behavioral cues. This is someone who smiles at you while they're staring daggers at you internally. They have an internal anger or sense of fuming. They often have difficulty acknowledging their own feelings. I think that emerges because they are trying to be nice. They're like, hey, you know, how are you doing, kind of thing. But inside, they're feeling much different. And it's very difficult for them to acknowledge, yeah, I am actually angry at you. They'll often deny that there's any issue, at least outwardly. They'll often divert to like sarcasm. And they'll often do sort of subtle sabotage, right? So they're not going to do anything overtly, but they'll do like little things that'll ultimately lead to conflict, and then kind of be like, where's this coming from? I don't know why you're mad at me. Well, I'm mad at you because you did this thing. It's like, I didn't mean to do that. So that kind of subtle sabotage. Consequences, it looks very similar to aggression, alienation. So people don't want to be around them. There's generally a lack of growth or development. They're not going to be, because they're not doing effective communication. Their needs are never going to be met. They're not going to get anywhere, right? And a lot of times what they're doing to get back at you, because they're not acknowledging it as aggressiveness, then there's nothing to call them out for. And then discharge resentment, right? So like they're trying to deal with their resentment in very passive ways, so that need's never going to be met. In terms of dialogue, these are people that will often, their internal dialogue will say, I'm powerless to deal with this head on. I have to use these subtle strategies, because if I deal with it head on, kind of like a passive thinker, I'm scared I'm going to get attacked. I'm scared the other person's going to retaliate. So I have to deal with this a different way. Or I fear the consequences if I'm forthcoming. So I have to find another way to deal with this. I'll get back at them, but they can't know it. The person that I chose for this one, if you've ever seen the Harry Potter movies, is Umbridge. I think is the perfect example of someone who's passive aggressive. So if you feel like maybe you're someone who is passive aggressive, some things that I would encourage you to do or work on are private reflection. So if you have difficulty acknowledging your feelings, I think some private reflection can be really good. What am I feeling? Like, what are my actual feelings on this? I'm hurt, I'm angry, I'm sad, I'm upset. Why am I feeling this way? Well, I'm feeling upset or I'm feeling hurt because someone said something to me that really hurt me. Do I feel angry? Yeah, I do, maybe. Do I feel overlooked? Do I feel unheard? So kind of acknowledging the way that you feel, like the way that someone with a passive personality style feels, but admitting it to yourself. Communicate, 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 right? So once you're able to identify the way you're feeling and you're able to have that acknowledgement yourselves, starting to take that passive, the advice I gave to the passive person, being able to advocate for yourself, being able to express your feelings and emotions now that you're able to identify them. Weigh the current behavior versus what you really want, right? So if you're doing something passive aggressive, I think a really honest and important question you have to ask yourself is this going to get my needs met? No, it's not. What are my needs? What do I actually want? Like, I can leave the post-it note, but is that going to get me anywhere? Is the person going to listen to me? Are they going to be able to compromise with me? Are they going to be able to meet my needs? No, they're not. And have a positive solution focused mentality. It's not about getting back at a person. It's not about, again, sort of like the aggressive, it's not about winning. It's about compromise. It's about communication. It's about meeting needs. If you feel like you're dealing with someone who has a passive aggressive communication style, some things I would recommend: try to understand their motives as much as possible, right? If this is someone who they're not maybe in good touch with themselves or their emotions, trying to wrap your head around, well, what did I do, right? Why are they responding this way? Did I say something hurtful toward them? Did I make them angry? So trying to understand that. And then sort of reflecting on what maybe did I do to contribute to this? Did I approach them with an aggressive style? Did I not listen to them very well and now they're feeling unheard? Just sort of reflecting on that. Similar to when you're dealing with someone who's passive, give them an open and safe platform to be able to express themselves and their needs and their concerns. Like, hey, I feel like there's just really something going on here. And I just want to check in with you. I want to give you the opportunity right now just to kind of tell me what's on your mind. Tell me how you're feeling about how things are going. So just kind of giving them that platform. Offer positive affirmations and avoid criticism, right? Criticism is what they fear the most. That's why they interact the way that they do. So just positive affirmations like, hey, you're mad at me. I understand. I'm mad at you too. That doesn't mean I don't love you. I still love you. I care about you. I want you to be happy. We just have to figure this out together. So that's that positive affirmation, letting them know that no matter what they're doing and what they're trying to express themselves, that their worst fear is not going to come true. You're not going to abandon them. You're not going to yell and scream at them. You're going to work with them. You might be angry with them, but you still care about them. And then use active listening and reflective statements. And we're going to talk a little bit about that too in a minute. So the final one that we talk about is kind of the gold standard. This is sort of what you want to aspire for, and that's an assertive communication style, right? So I think of Superman when I think of this, right? Superman is like the most powerful being in the comic book world, but he's someone who doesn't hurt people. He tries to help people, right? Despite the fact that he has that great power, he's very confident in himself, right? So he's not aggressive, but he's self-confident. So the behavioral characteristics of someone who's assertive, they have very clear, appropriate, and respectful expression of their needs. Hey, this is what I'm kind of observation, and this is what I would like from this interaction. This is what I want to gain. This is what my needs are. But and also clear, appropriate, and respectful expression of our emotions. Like, hey, I just want you to know, like right now, I'm a little bit upset with you. I'm a little bit angry at you. Here's kind of why I'm feeling that way. They use I statements. So that is basically, instead of like you, this is your fault, you're to blame for this, you're sort of taking ownership by acknowledging that what you're thinking and feeling is what you're thinking and feeling. So I am feeling hurt right now, not you hurt me. I am feeling hurt by what was said. You know, I am observing this interaction right now, not like you're being too aggressive. You need to back off. It's like, right now I'm kind of observing tension and aggressiveness in the room. Like I want to point that out and talk about it, right? So I'm not criticizing the other person. I'm just taking responsibility for what I'm observing and seeing in the moment. Active and respectful listening. Again, we're going to talk about that separately here in a minute. They're confident, calm. They have a control over their disposition, so they're not going to get angry. They're not going to get real anxious or scared. They're just going to they're not going to be aggressive, but they're going to maintain their ground, right? They're going to say like, I'm willing to talk to you. I'm willing to hear you out. I'm willing to compromise, but I'm not going to give in, right? I'm not going to back down, and I'm not going to get in your face. So they have a very relaxed posture. It's not the slouched, poor eye contact. It's not the aggressive crossed arms either. It's just kind of relaxed, good eye contact, that kind of thing. Consequences. Often people who are more assertive or more connected to others. We're generally attractive to people that we would describe as confident and assertive. They often feel in control over their environment. They feel like there's something I can do about this, right? I can address this issue. So they have that sense of control. And they often have their needs met, or they achieve maturity in their relationships. They learn to deal with the aggressive personalities. They learn to deal with the passive personalities, right? So they have self-growth and maturity, and they often get their needs met. Dialogues, to someone who's assertive, this is the type of things that they'll say to themselves. We are equally entitled to express ourselves. I cannot control others, but I can control myself. And I think that's an important one. We often fear about others' reactions. Well, oftentimes we don't have control over that. The best we can do is control the way we interact with other people. And that's ultimately going to give us the best likelihood at a positive outcome. It doesn't guarantee us a positive outcome. And nobody owes me anything unless they've agreed to give it to me, right? So like, that's what compromise is about. Me expressing my needs and understanding that not every single thing I want is going to be met, and I'm going to have to compromise and give something up as well, and that's okay. So just some strategies or tips to become more assertive. Some of this we've already kind of talked about as we talked about the other styles, but to be able to identify your needs and be able to express them clearly. Try to identify what the other person's needs are, especially if they have a hard time identifying what their needs are. Having a solution-oriented focus. Like, this is about solving a problem. This is about compromise. That's it. Being positive, being sensitive. Like, hey, we're going to work through this. We're going to figure this thing out. Being sensitive. Like, hey, I've talked. I want to give you a chance to talk. How are you feeling? So sort of a statement example of this. This is what I need. I hear you telling me this is what you need. Here are some possible compromises. What are your thoughts on this? What do you want to offer? Watch your language. So I often tell people to avoid sugar-coated or softened language, right? Or very softened language. I will versus I might. Yeah, I'm going to do this for you. I'm going to follow through on this. People like to hear that. People don't like to hear, I might try to do that when I get around to it eventually, right? Learning to say no, we've kind of already covered that one a little bit. Learn to be an active listener. Again, we're going to talk about that here in a moment. The I statements, taking ownership and saying like, hey, if I offended you, I'm sorry I offended you. I didn't mean to do that. Like, I'd like to talk about maybe how in the future you'd like me to communicate with you so that we avoid that next time. So taking ownership for your part of the communication or your role in the dynamic. And another thing I always encourage people to do, make time for talking, right? Difficult conversations have to be had, and every relationship has difficult conversations. And the more we avoid them, it's like having termites in your foundation, right? You might not see the foundation eroding right now, but there's going to be a cumulative effect that's going to blow up at some point. So I think it can be really important not only to feel like in a dynamic that you can have a really good conversation, But above and beyond that, also just set some time aside once a week, once a month, to say like, hey, I just want to check in. How are things going? I said we agreed last time we would reach this compromise. How do you feel like things are going there? What do we still need to work on, right? So keeping the dialogue open. All right, now let's talk a little bit about active listening. I think it's one of the most important skills that people can learn. And sometimes we can be bad at it. And even if we're kind of good at it, we can always get better at it. So just some tips on how to be a good active listener, right? And really, some of this is just think about how you want people to listen to you when you're talking. So one is paying attention, try to maintain good eye contact, right? So when I look at people, I try to like just kind of listen, follow along, show them I'm listening by looking directly at them. Don't be preparing your rebuttal is a big part of that. So like paying attention means that you're actually actively listening, not sitting there pretending to listen, nodding and making good eye contact, but you're like, man, I got something lined up for them. I'm going to hit them hard the second they're done talking. Looking at body language. So earlier I said, I don't think people focus on that enough. And that's focusing on your body language. What am I doing right now? Are my arms crossed? Am I furrowing my brow? Do I look aggressive? Do I look too positive? Do I look disinterested? Am I rolling my eyes, right? And then looking at the other person saying like, well, as I'm talking or as they're talking, what's changing? Like, what are their behaviors? Or what's their posture like? Are they maintaining eye contact? Are they looking down as they talk to me? If they're looking down as they talk to me, that means they're really uncomfortable. How can I make them more comfortable? Show respect and interest. So, kind of nods or those kind of things. I already mentioned body language a little bit, but having an open posture, arms not crossed, just kind of like listening, sort of a neutral, relaxed posture. The more closed our posture is, whether that's like this passively or this aggressively, it makes it hard to talk to someone who's maintaining that kind of posture. Provide feedback. So we already talked a little bit about I statements. Get comfortable with that kind of wording, right? We often, especially when we're arguing or in a fight, we kind of jump to those kind of you statements like, oh, you did this, or this is your fault, or you caused all this. Your I statements are saying what I'm hearing is, right? So you're not saying, you're saying that I'm a mean person or an evil person. No, you can't read people's minds. Ultimately, that's a truth, right? So what I'm hearing you say is that you feel like I've attacked you, right? You feel like I've hurt you in some way, and this is why you feel that way. So that's using an I statement. Ask for clarification. So I don't really understand what you mean when you're saying this. Could you try to explain that to me again in another way? Because I want to understand. So please tell me, try to explain it to me again. Or is this what you're trying to tell me? Like, this is what I'm hearing. Is that accurate? Like, is that what you're trying to say? So you're not telling them what they're saying. You're kind of giving them sort of a summary or your interpretation, and then you're asking them to clarify. Like, is that what you're getting at? And then I always encourage people to summarize what they're saying periodically, right? People like to know that they're being heard and being validated. So if I'm telling you that you hurt my feelings or that I'm angry at you, I kind of like it when you might say something like, yeah, I hear that, you're angry at me. Something I said really hurt you. I'm sorry, I didn't mean to hurt you. When we tell people that, they're kind of like, yeah, I am being listened to right now. That's a good feeling. And then I've said it already, but I'll say it again. Take ownership, right? Continue, use those I statements. I think that's one of the most important takeaways you can have from this entire talk. So what I heard you say was, that made you feel blank. And could you please clarify what you meant by that, right? So just, again, taking ownership of that and being able to say, this is what I am feeling about what you said. This is how I'm interpreting what you said, not this is what you said. Defer judgment. And when we're in an argument, this can be one of the absolute hardest things to do. But we have to be able to reflect on that impulse to just kind of get back at the person, right? Let the speaker finish their points, no matter what sort of reaction that might be brewing inside of you because of their words. Let them finish their points, right? Avoid the urge to interrupt somebody and say, whoa, 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 I don't think that's quite right. Like, let me interject there. Let them finish. Then you'll have the opportunity to say, I think this is what you're saying. Is that right? Okay, well, I don't quite see it that way. Here's how I see it. And don't just infer or overgeneralize. So that's kind of what I was getting at with those I statements. What you're hearing, no matter what you hear, is your interpretation of what's being said. Even if that's what they actually meant, you don't know that's what they meant until you clarify. So don't make those inferences. Say, this is what I'm hearing. Is that what you're saying, right? So that's that kind of avoiding those inferences. And respond appropriately, assertively. Be candid, open, and honest. Like, okay, this is what you've said. This is what I think you meant. Is that what you meant? Okay, that is what you meant. Here's my reaction to that. Here's how I feel about what you just said. Be clear when asserting your opinion. So saying like this exactly is how I feel. You can even ask like, do you understand what I'm saying? Do you need clarification for that? And I've said this several times too. And another important takeaway from this talk is feel free to take a minute to gather your thoughts, right? I feel like people are just so anxious to respond that they'll just kind of like word vomit a little bit. It's okay to take some time to just relax. Like I know my patients know this about me. If they ask me a very thoughtful question, my nonverbal is I'll kind of like nod and I'll sit back and I'll do this number, right? So it's showing that I'm still active and engaged, but I'm conveying to them that I'm giving serious thought to what they've said, and I'm giving very serious thought about what I need to say next. So it's okay to gather yourself. It's okay not to just react to whatever emotion that you're feeling in the moment. And feel free to express that need. Like, hey, you just said a lot. I need to take that in. Give me just a minute to reflect on that and gather my own thoughts. So I said a lot there, and I wanted to throw up this graphic because I think it's sort of a quick and easy reference tool that you can use. Okay, how do I active listen? So pay attention, withhold judgment, reflect and summarize, both internally and externally. Okay, this is what this person is saying. This is how I'm feeling about what they said. Now I'm going to say that. Like I'm going to say, okay, this is what I heard you say, right? So that's that reflection piece. That leads to the clarification piece. You know, this is what I heard you say. Is that right? Is that what you said, right? Provide that summary to them, which is the next point. And then share. Have that reciprocity. Say, okay, this is how I'm feeling. How are you feeling? Okay, that's how you're feeling. Like, let's continue to build that bridge of communication until we identify each other's needs and we reach a compromise that we both feel satisfied with. We both can walk away feeling like we gave something and we're getting something. So beyond this talk, obviously a 45-minute talk or 50-minute talk is kind of hard to convey everything and all the knowledge that we could give, and doing a topic this important, it's full service. So things that I would encourage you to do is reflect on your needs. One, can you identify your needs, right? And how can you become better at identifying needs? Are your needs being met? Yes or no? And is your response style that you're using conducive to getting those needs met, right? What can you improve about your communication style that'll help you get those needs met? And do you know the person that you're thinking about, do you know what their needs are, right? And are you meeting those needs? So a lot of times we shut down communication because we feel like our needs aren't being met, and other people will shut down communication with us because they feel like their needs aren't being met. So we have to constantly balance that and keep that in mind. I mentioned this earlier, but set some time aside every week or every couple of weeks, however long, just to check in. Have a space dedicated to tough conversations. I think we often have a tendency to build and build and build, and we blow up. And not only is that our opportunity to talk about that thing that made us angry, but then the previous 10 things that we haven't talked about yet. And no one's going to get anywhere with that, right? We avoid difficult conversations until we're angry and we have to have those conversations. And a lot of times, positive outcomes don't come from that. So just setting time aside and saying, okay, this is our time. We can't avoid it. We agreed to this. Let's sit and talk. Let's check in with each other. Let's talk about how we're doing. Be patient with yourselves and others. You're trying to get better at communication. The other person is trying to get better at communication. So have self-compassion for the fact that you're trying to learn, you're trying to become a better communicator, and have empathy for the other person that they're trying to, right? You have to have self-compassion and empathy, I think, to build good communication. Be prepared for change to be difficult and frustrating. Change is difficult. It's hard to do something differently when we've done something one way for a long time. So it's going to feel unnatural. It's going to feel clunky. You're not going to be good at assertiveness and I statements right off the bat. That's okay. That's normal. It's okay to be frustrated by that. It doesn't mean that it's not worth trying. And I always tell people communication can reach the point where it's so difficult that everyone feels like that they're at a standstill. I always recommend counseling. I think counseling can be great, both for the individual and for couples or families. So if you feel like you're just in an impasse, things just aren't really working, having a professional there to help guide some of these skills, to help give you advice, to help practice the communication with can be quite valuable and can get you to where you want to get much faster. So that's it for the talk. And here in a second, we'll just open up for we'll open up for any questions. I just want to say thanks to everyone at MS Focus again. I really love doing these talks. I love communicating with people. I really hope that you benefit from these talks. It's something I'm very passionate about. Dr. Kelsey Hewitt's my significant other. She always tends to help me review these things and practice and proofreads my slides and stuff. So I'm always very appreciative of her spending her busy time to help me with these things, and just the wonderful people I work with to have the opportunity to be able to give these talks. So thank you as well.
All right, thank you, Dr. Brown. And now we will open it up for questions. To our listeners on Zoom, if you have a question, you can type it in the Q&A, which will allow you to ask it either under your own name or anonymously. You can type it in the chat box, or you can hit the raise hand button if you'd like to ask your question live. To our listeners on Facebook, if you have a question, you can type it in the comments and I will make my best effort to get to those. Sometimes they move a little bit fast. To start with, LaRufus Burrow on Facebook says the problem that he's facing is that when you set boundaries, people treat you like you're crazy and difficult. How do you deal with that?
It is difficult. I mean, I think you're absolutely right. I mean, basically, the kind of the modern buzzword we're using that for light is feeling like we're gaslit, right? Feeling like we've done something wrong or we're the bad guy for setting the boundary. I think from an assertive communication, the most important thing you can do is kind of have confidence in yourself, right? So be able to affirm and validate yourself to say, it was good for me to set this boundary. I needed to set this boundary. Just because someone else is trying to invalidate your point or your boundary doesn't make it so, right? So have confidence in yourself that you had the wisdom to recognize that that was an important boundary to set, and there's a reason you set that boundary. And you can listen to the other person. You can sort of take what they're saying into consideration and saying, like, okay, maybe they're making some good points. Maybe we could compromise on what the way that boundary looks like, but I needed to have set that boundary, right? So you can be respectful to them and their point of view while maintaining your confidence in yourself that that was the best thing for you to do.
And our next comment is from Joe on Facebook. Joe says, we have problems in finding our voices and asking for help at the same time. What advice could you give to Joe?
I think some self-reflection is important there. So sort of identifying kind of the who, what, where's, and whys. So what about the dynamics of the relationships I'm involved in makes it so difficult for me to ask for help, or makes it difficult for me to advocate for myself? And what are things I can work on? So going back to that idea of we can't control everything in our environment. And even when we're feeling out of control, there are things in our environment we can control, right? Ultimately, no matter how hard we have to look, those things can be identified. Identifying those things and taking ownership of them. Okay, I have a passive communication style. How can I be more assertive? How can I try to get my point across and get better at that? You might not get better at that overnight, but practice it. And I'll tell people, like, it might sound silly, but like, do some private role play, like get in front of a mirror, practice saying an I statement, practice trying to maintain a more assertive posture, practice confidence, right? You don't walk into the Super Bowl and the first time that you throw a pass is going to be in the Super Bowl, right? Practice is there for a reason. So I encourage people to practice in a safe environment, get better at it before you actually maybe try to use it in like an argument. Does that make sense?
Absolutely. Sharon says, thank you. This was very informational. The biggest problem that she's dealing with is communicating with passive aggressive people. She says, I'm glad you talked about the timing. Unfortunately, sometimes the person won't make time. What's a good way to approach that issue?
That's a very good question. And I will be the first person to tell you that sometimes I struggle to deal with passive aggressive people. It is very difficult because there's always kind of that like gaslighting effect, right? Like when you try to sort of call them out, even if it's gently, they'll often be dismissive. Or like in your instance, they can make a ton of excuses. So I think if someone is being passive aggressive because they feel like that you might attack them if they get into an argument with you, or you feel like you're not going to hear them, maybe you could approach it almost with an olive branch and say like, hey, I just want to check in with you. I want to hear about what your needs are too, right? So give that an opportunity for them to feel like you're going to approach them with a safe space. Sometimes with people who are passive aggressive, if they're really fearful of things like criticism or rejection, you almost have to, for lack of better words, maybe go a little bit overboard and just like really communicate. Like, I think it's important that we talk and communicate and kind of spin it to how it's going to benefit them and say, hey, I want to check in on you. I want to hear how you're doing. I want to hear how you're perceiving this situation that seems to be really difficult for both of us. So kind of expressing that, right? Giving them that safe space, I think can be really important when dealing with people who might be avoiding a conflict or avoiding a confrontation or a conversation.
Our next question is from Joe. Joe asks, what is the best way to get financial assistance to see a therapist? Any suggestions?
It's very difficult for a lot of people, depending on, it's difficult for me to answer that question specifically without knowing some more details, but some general advice I can give you. If you have insurance, even if it's limited insurance, maybe not the best insurance, you can always reach out through your insurance provider to find a provider. A lot of places, so it's actually in the mental health ethics code that we take a certain amount of pro bono work. So a lot of times you will find people who will work on either a sliding scale, like if you don't have insurance, they'll charge you a nominal or small fee based on how much money you're making, or they'll take you on totally free, and that can meet a need for them to sort of fill that professional attribute that we should be seeing people who have high needs. Oftentimes, not having insurance or having Medicaid can be the two most difficult. As far as I know, Medicaid either doesn't cover mental health or covers mental health very poorly. In those cases, I would encourage you to sort of search around, maybe call some local offices to see if they take people pro bono. Oftentimes contacting like some sort of state department, like some sort of department of resource. I'm kind of drawing a blank right now, like what the best office would be. But a lot of times if you call those resources, they'll help you out. And they might already have a list of people who will take people pro bono or on a sliding scale if you don't have insurance.
Thank you. We are just at about our time, but we have one more question that's pretty personal, and I'd like to have you answer that if you don't mind going a minute or two over.
Absolutely.
Okay. All right. So an anonymous attendee says, I would just like to be blunt and ask a question. Do you have any suggestions for not feeling like a blubbering loser when you've gone from being super independent to now being so broken you cannot do anything for yourself? How can you not beat yourself up and ask for assistance?
You're not alone in feeling that way. When people have a chronic illness, a lot does get taken from you, and it's really hard to figure out maybe where you fit in life and what your role is. I think after being diagnosed with a chronic illness, especially something that could be progressive like MS, you are valuable. I think that's the first thing you need to hear. You need to hear that from me and everyone else. You are valuable. Everyone has value. You should value yourself. And I often tell people to sort of reflect, because when something is taken from us, it's a threat to our environment. So we often really get focused or hyper focused on what we've lost. And then we can sort of lose sight of other things. So oftentimes when I'm dealing with someone who's struggling with that self-worth or that self-esteem issue, I'll tell them, like, think outside the box, take a step back and ask yourself, does everyone feel about you in this situation, right? So if it's maybe a provider who can't work anymore and they feel like they've lost that, it's kind of like, well, you're still a brother or a father or mother or sister. You're something to someone. It doesn't matter what your circumstances are. And you have to acknowledge that, and you have to recognize that. And then apart from that, I would say, I know that just saying that in this moment might not be the most powerful thing to hear. And that's another situation where I might recommend seeking therapy, right? Trying to work with a professional that can help you see that better in yourself. I promise you it's there, you just don't see it.
And one last question snuck in under the wire.
Sure.
Another anonymous attendee who says, I have MS and I'm 36. I currently live alone and have trouble navigating this new lifestyle. Do you have any recommendations for a passive communicator to assert in a medical and personal environments? I have been dismissed time and again until I met my current neurologist, but going forward, I have no confidence when I don't have that backing from friends and family. Not that they don't care, they don't understand. Thank you.
You are valid. Your needs are valid. It doesn't matter how maybe other people receive that. And so that's kind of that piece of it's difficult because we're social creatures. We look to others to sort of make self-evaluations for ourselves, but the information we get from other people isn't always valuable, right? So I think having that confidence in yourself, validating yourself, reminding you that your opinion is valid, your expression is valid, and you deserve to be heard. And I think when it comes to like professional relationships, when people don't feel heard, the thing I often say is like, you do deserve to be heard. And it doesn't matter, I think, how many people you have to see until you feel like you are heard, right? You shouldn't have to compromise or settle when you feel like your needs aren't getting met and you aren't being heard. And if you are willing to be vulnerable and you're willing to express your needs, and that's met with dismissiveness or aggressiveness, that doesn't actually say anything about you. That says something about that other person, right? That says something about that provider that's dismissive and not willing to hear you. It's not your lack of value, it's whatever's going on with them. That's something they need to seek counseling for, not you.
That is an empowering thought to end on. Thank you, Dr. Brown.
You're welcome.
Just a few matters of housekeeping before we close. I'd like to ask all of our listeners on Zoom to please take a moment to fill out the survey that will pop up when you leave the webinar tonight. Filling out those surveys really helps us to know what kind of programming is important to you and how we can best serve you with the programming that we do in these webinars. I'd also like to encourage you to join us next week for our next teleconference. On Tuesday, that's May 10th at 3:30 p.m., Dr. Ben Thrower will be discussing devices, gadgets, and doodads that may help your walking. We hope that you'll join us for that. We thank you all for joining us this evening, and most especially my thanks to Tyler Brown. Thank you so much for the time to share this information. I know it's been tremendously well received. The comments are coming in. We've had people say they want to share it with their children, share it with their families. We really appreciate you. Thank you so much.
Thank you, and have a good night, everybody.